Captain, it's an emergency charge nurse. Can I help you?
Alder Casualty Department can treat more than 1,000 children a week.
Liam Saunter, please.
Mike Callahan is the charge nurse.
Liam. That wouldn't be your face, would it?
I fell off the bike.
Let me have a little look up here. Have you been sick, Liam?
No.
Do you want to just open your mouth for a second? Just tilt your head back. That's it up there. I just want to check that you haven't... You've got a tiny cut in the top of your lip there. All right. OK, you can open it now. Leave it alone. Doctor will be here in a few minutes.
OK.
All right.
Yeah, thanks very much.
Registrar Dr. Simon Clark has been called down to casualty. He's come to see another patient, 2-year-old Lindsay Devlin, who has a recurrent chest infection.
Hiya. You want something? I met you before.
Yeah.
Yeah, on the wards.
Yeah. Every time she has a chest infection, she usually gets a message.
Comes in. OK, if you hold on there, I've got to have a look in her ears and throat. Yeah, I'll just get something to do that with. Great thing about children is that they can hide infection anyway, so you have to make sure. Great thing about the NHS is nothing ever works. So you have to make sure that you look in every orifice you can, including the ears and throat, and it's something that an adult doctor would never have to do. Any chance of a working earoscope, guys? Or batteries, even?
Have a look in the... Shut up.
You can spend up to 3/4 of your day doing this sort of thing.
It didn't happen in my road, it happened round the corner and someone brought him home.
I was in pain.
Where?
All over.
All over. Are you allergic to anything?
No.
I am. Cottage cheese.
Oh, that's all. God.
And he's had all his vaccinations?
Yeah, he's had everything, yeah.
Right, no serious illnesses?
No.
Great. And apart from your face, all your arms and legs okay now?
All stinging.
They're all stinging. Right, we're going to have a look at your head then. It's a bright light, okay? Look at me. Very good. Look at me again. Bright light. Just feel your nose now, all right? Good lad. His nose is fine.
OK.
So mainly it's just bruises and grazes, really.
Nice.
Oh, fab. I know. That's horrid, isn't it? Yeah. All right, shall I have a look in your mouth? Oh, I know. Oh, I'm horrid, aren't I? Oh, that's nasty. Yes, OK, that's fine. They're all clear. I mean, her chest X-ray does show she's got a little bit of patchy change on it, just about there, if you can see. So I'll go and have a rummage in the drug cupboard and see what we've got. And I'll come back and give you some. 90 mils of water, here we go. OK, drinking water. Very technical, this. This is how pharmacists earn a fortune, OK? This is all they do all day. Do you think? I spent 4 years at college to do this as well. I mustn't mock. Well, that was really slick. That's what you get for teasing about other professions. Let me get another fresh one out.
Right, Liam. All I'm going to do is clean your grazes with some water, OK? I'll be as gentle as I can. You just have to stay very still.
Got those your hands?
Oh, it's stinging.
I know it will, because you've got a big lip. All right, all right.
Well done.
It's just getting the muck out of your face.
All it is, Mum, is sterilised salt
Yeah.
water.
I'm a nurse.
Very mild salt water.
I'm a nurse myself, so I've used it. It's different when it's your own children, though, isn't it?
It is. Nearly there, Liam. Down your nose now. All right.
Yeah.
All right.
OK, just sit down. Just stay there a minute.
There you go.
It's
All
gonna
gone.
sort you out.
Here you go, Mum. All done.
OK, thanks very much.
Up you get, Liam.
Thanks very much.
OK, and tell him not to worry about washing. You can still wash it.
OK, that's fine. Bye.
Probably doing this all wrong. I think I'm meant to add it in 2 amounts and then shake vigorously for the purists out there. I could be a pharmacist. Right. So this is something called augmentin. I don't know whether she's had this before. Okay, all right. It's very good for chest infections. It covers most known germs. Okay, 5 mils of this 3 times a day. Okay.
Up on Alder orthopaedic ward, senior consultant John Dorgan is visiting 15-year-old Penny Bateman.
So what sort of weekend did you have?
Okay.
Okay, a bit uncomfortable
Grumpy.
at times. She was a
Grumpy.
little bit grumpy yesterday, but
Yes.
only a little grumpy.
Are you managing to eat and drink yet?
Yeah.
Less than a year ago, Penny developed a severe curve of her spine. It was becoming worse, and without surgery, she would have been permanently deformed. The 8-hour operation to correct the curve involved John Dorgan collapsing a lung, taking out 8 ribs, and reforming the spine in a new position. Before the operation, Penny's spine was bent by more than 70 degrees. Now it's virtually straight and held in place by an 18-inch metal rod.
That's what you look like on the chest x-ray.
Yeah.
It's completely clear there, there's no fluid. That was the tube, which has now been removed.
Right.
The lungs fully up, and again you can see how straight the spine is compared with the
It's marvellous, isn't it?
pre-op. Yeah, so we'll get you going in a day or two, just let you recover a little bit more, and then we'll try and get you back on your feet. I hear the wound is fine, I'm not going to turn you over, but sister tells me that's fine, looks very good.
Looking forward to being able to sit up,
That would be nice.
get my voice back.
That would be the next big step, really, won't it? Sitting up.
So we'll see what you look like when you stand up. You might be a little bit taller.
Yeah,
I think you'll be as tall as me then.
don't know.
Won't be far off.
Yeah, the odd child. There's one girl who's about 2 inches taller. She came to clinic and she said that her younger sister wanted the same operation to be as tall, and she didn't have a curve, so I said, no, you're not having that done. Right? It's a lot to go through, isn't it?
It's the next day, and Mike Callaghan has called in Simon Clark to look at 9-year-old Sean Finnegan, who's been referred to casualty. Simon has examined Sean and has decided to scan his head.
I've got a headache and it's numb here and here. And I did have swollen glands, but they've gone down now.
You feel a bit sick?
Yeah, I've been sick quite a few times as well.
We took him to the GP this morning, Dr. Stooley, and he referred him to Simon. And they're going to do a scan now to see what problem there is.
Over the last 2 days, his dad's noticed his eyes actually started to swell out. And the vomiting's actually got worse. He's not really been tolerating much in the way of food. And it's fairly sort of sudden onset. We need to, I've told Sean we need to take some pictures of his head to find out why his eye's swollen. And I've explained to Dad what we're going to do. We need to identify what the cause of this swelling of his eye and his vomiting is. I think an infective cause or an abscess is unlikely. There hasn't been any pus coming from his ears. He's not got a fever now. He hasn't had a fever for the last 48 hours. And so all of those things make an infective cause extremely unlikely. I think what I'm really worried about is that he has got a lump growing inside his head, some sort of tumour.
Okay, well done. Next was 2 minutes again.
Some form of cancer sitting behind his eye there.
Simon now needs to consult the radiologist and cancer specialists before he discusses the scan with Sean's father.
All right, Sean. Another one coming up.
As a father, I wouldn't like to think of myself in Dad's position. Not at all. Not at all, but Dad is extremely strong at the moment and needs to be, certainly for his son. In the accident and emergency department where these just literally come through the door, then you have to respond to it and you have to be mature and professional about it and respond in the right way. Because all the time you're thinking, this could be my child, this could be my son, this could be my daughter, you know.
In the neonatal unit, Leon Pearson is one of the hospital's youngest patients. He was born 4 weeks ago with his stomach outside his abdomen and had an emergency operation to repair the condition.
Don't actually go with his yellow night dress, but...
His mother, Angelina, had been hoping to take him home, but Leon needs further surgery to remove a temporary patch sewn in to protect his stomach.
Going down about 2:30 to theatre. They'll take his patch out and they'll take a sample, like do a biopsy on his liver to make sure everything's all right. When I was in Warrington Hospital, I was still up off the drugs that I had through the labour, so it was just sort of every time I woke up I'd ask how he was, but I just felt lost then. Didn't feel like my baby, so it's worse this time, I think, because I know he's my baby now.
Get this over and done with and get you home, eh?
I can't wait to walk through that front door.
Leanne Pearson, date of birth 12/9/96, 805664.
Leon's 40-minute operation will be carried out by neonatal specialist Steve Donnell.
Right. Tell Mr. Donnell he's on.
I'll do that side, thank you. What we need to do is remove this little patch of Gore-Tex that's replaced his abdominal wall muscles in the middle here. Extend our incision up here and down here into the belly button a little bit, and then dissect the actual Gore-Tex which lies in under the skin here. My fingers sort of marking the edges of it. Come on, goodbye for me, please. Hi, Sean.
Hi, Sean.
How's your head? Is it still bad? Okay. Yeah, of course you can have a pillow. Sean needs a pillow. This is a disaster. What's the NHS coming to? All right, that's fine. Okay. I just had a look at your scans, okay? All right. Okay. And I think we're going to need to ask some other doctors to come and have a look at you, find out exactly what's going on. Okay. All right. I think what I need to do first is I need to have a chat with your dad, and then we can come back and talk to you, all right, and tell you what's going to happen, all right? The radiologists, the X-ray experts, have had a look at it, and they've said one of three things that it's likely to be. Right. The first one's a rhabdomyosarcoma, the second one's a lymphoma, and the third one is infection. Probably all that matters in terms of at the moment is that the top two are a form of cancer. Okay. Okay. We need to arrange for a piece of this to be taken and to be looked at under a microscope before we know for certain that it is either a cancer or some sort of infection or something else. Okay. What do you want to tell Sean?
What's a euphemism for it then that might be?
Well, I mean, we can sit down and I can tell him that we've seen a lump behind his eye.
That sounds.
And that we need to take a piece from it to decide what to do with it. Yeah. And that I'm going to ask some other doctors to come and see him to organise that. Yeah. Okay.
That sounds sensible.
It may not be, you know, as serious as we think it is at the moment. I think it is going to be very serious. But I mean, you know, we need to make certain before we, you know, launch in with Sean, I think.
So I'll see you Monday. So see if you can read through
Hi, Sean. Pardon?
We need your option on.
No, what's going to happen is they're going to put two things in your arm, okay? One to kill the pain and one to put water back in your body, okay? So you're going to have to stay here for a bit longer, right? You know the bad head you got, the bad headache?
Yeah.
And you want that to go away, don't you?
Yeah.
Apparently, Simon tells me there's a little lump behind your eye, okay? And that's what's causing the pain. So he wants to have a look at that.
I just want to go home and sleep there.
If it's lymphoma, his rates of cure go up to between 70 and 90%, I think. If it's a rhabdomyosarcoma, it's a bit lower than that. If it's infection, it should be 100% ballpark. And if it's something else wild and wacky, because you can get all sorts of other nasty tumours, then I don't know. But, I mean, you know, the answer is still, we don't know.
Steve Donnell is halfway through baby Leon's operation.
Horrible bleeding is listed, eh? There's a little patch. There we go. We've removed the little patch, and underneath you can see this good, healthy, healing granulation tissue. That's fine, that's going to come there all right. I just wonder if I've got enough. There we go, that's it.
Sean is being moved to Alder Hayes' sister hospital at nearby Walton, the regional centre for child neurosurgery.
They may go for a one-hit surgery so that they try and get the entire bits of the lump out, the nose, the behind the eye, and the stuff that's just inside his brain cavity, and try and get a good clearance of it. Or they may just take some stuff from his nose and look at it under the microscope so that they know what they're dealing with.
The emergency surgery will be carried out tomorrow. An hour after his operation, Leon is awake.
Hi. How are you? Everything went fine. All right, we got it. What we did was we sort of took out the little patch, made a little incision just up this way, and a little cut down here just into the top of his belly button. All right. Took the tissues back so we could see the patch and cut the stitches out. All right. Stitches sort of went round, lifted it off, and then the skin is sort of a little bit slightly baggy, but rather than trim it and things, let nature take its course. I've just put some little interrupted stitches in the skin.
Yeah.
All right.
So how long do you think it'll be before they go home?
Well, he should be able to feed later today or tomorrow. Make sure the wound's all right in, say, 48 hours' time. And then it's off home. All right. And hopefully no further trouble from that belly button of his. Okay.
Thanks very much,
Cheers.
Steve.
Okay, no problems. Okay.
Next day at Walton Hospital, neurosurgeon Paul May comes to visit Sean.
Hello, Paul. How are you? Good morning, Sean. How are you feeling this morning?
I've had some painkillers and my headache's getting a bit better now.
You feel a little bit better. You look a little brighter this morning. Your head's still sore. Just going to feel your head. Okay. Today, Sean, we're going to do this little operation for you to make you better. Not worried about your haircut or anything? Not a number one, eh?
You don't want one of those. Okay, we'll see what we can do.
Just where the little cut is, we just have to take it down a little bit thinner than a number two. But for the rest, you can have a number two. Okay. All right then. Okay, see you later on.
Could I have a number one around the sides and two on top?
A number one around the sides?
Yeah, and a two on top.
And a two on top, no problem. Yeah. Okay.
Paul first examined Sean last night. He's certain there are abscesses in his head, but won't know whether they're caused by infection or tumour until he operates.
We're going to make an incision over the left side of his head, take the skin forward, take the muscle off the side of his forehead and cheek. Maybe take this little fragment of bone, the zygomatic arch, off to give us more access. Drain the abscess that's deep in the cheek, under the muscle. Drill a hole into the front part of the skull, staying outside the brain substance and outside the leathery covering of the brain, and drain the abscess deep behind the eye, and then make a hole in the medial aspect of his eye and drain the collections of pus that are around the inner aspect of the eye on that side. We are still unsure as to what the cause of this is, and there's a possibility that there may be underlying tumour. We're not sure. It's not clear as to where this mass has come from.
Sean makes his own way to the operating theatre in the hospital's electric jeep.
Good lad.
In isolation, it's relatively straightforward procedures that we're going to undertake. The unusual thing about Sean's case is that is the multiplicity of the abscesses, their position, the lack of an obvious causative factor, and the uncertainty of the diagnosis.
The exploratory operation will last up to 5 hours. Back at Alder, Penny Bateman is being fitted with a surgical corset.
Come round now and fasten up.
Okay.
The supportive jacket will protect her upper body while her spine fuses together in its newly straightened position.
How do you feel?
Okay.
No. Points in your head again?
No.
No.
It's only 10 days since her surgery.
That's fine. Okay, you're all done now.
It's steady.
Feel dizzy?
Yeah. Do you want to
Well,
walk?
nice and light.
Yeah? I feel all right? Yeah? You're wobbly-legged? Oh, yeah. Do you want to go back and sit down again? Do you feel faint?
No.
No? Feel all right? Do you want a bit more of a walk?
Yeah.
Or
Yeah.
where? Right.
Down there.
Okay. Do you feel all right? Yeah?
It will probably take Penny 6 weeks to regain her full strength.
Yeah?
Yeah.
Do you want to go back?
No.
No.
Hi. Oh, don't you look lovely? Madonna. How does it feel?
Good.
Let's have a look at the back. Feel okay? Is Dave happy with it?
Yeah.
Brilliant. Right, off you toddle off.
Great.
Are you okay? Do you need me? You don't need me.
No, we're fine, thanks.
Go back.
Leon's a month old, but he's never been outside.
Oh, it feels weird pushing a pram now because you only ever have them up on the ward. So it's nice. Yeah, normal.
Angelina will look after Leon on her own for the first time at MacDonald House, the parents' accommodation.
I've been here since Leon was born. It's really, really nice. I mean, you have everything that you'd have at home. You have your own kitchen and all that lot. Your own rooms.
There are a lot of other parents in.
Yeah. There's like parents coming in and out all the time that have just come in for a couple of nights or whatever, but there is long-termers that have been here for like 6-7 months at a time. So they're all like you get to meet certain people. Like some people keep themselves to themselves, obviously, because of what's going on with the kids and everything. But there's a few of us like will sit in the smoke room at night.
Doing what?
Laughing and joking, because if you don't laugh, you cry. And we're all from different parts of the country. We're all like, I don't know, some of us are posh, some of us are common, like moi. Really common. But it's dead weird. So hope everything goes all right now. Just want to get home and get back into a normal routine, like a normal parent.
Are you able to stand up for a minute next to Sister Charlotte?
John Dorgan examines Penny for the last time before she goes home.
Oh, it's corrected it very nicely. Nice and square with the pelvis and the shoulders there. That rib prominence has flattened out nicely. This will all heal.
Yeah, it's good, isn't it?
OK, Penny, thank you very much.
There you are.
Now then, a few do's and don'ts. Anything you want to ask?
Is there anything that she shouldn't be doing?
Well, obviously no gymnastics just yet. Probably excuse you from the washing up for a week or two as well. And then what she has to be careful with is bending. She has to bend from the hips and be a little bit careful. She'll probably need some help to put shoes on initially.
Right.
Yeah. Other than that, feed her up. I think she's wasted away on hospital food.
I think she has.
So you can take her to some of those nice pubs around your area. Yes, a few meals out.
And what about her going back to school?
I would think she'll let you know when she feels she can do it. I think she'll be off for at least 5 or 6 weeks. It's been a big ordeal for her. But I'm glad it's gone so well.
Yes, we were
happy, are you, then?
delighted.
Yeah,
We're absolutely delighted.
I'm glad it's gone well.
At Walton Hospital, Sean's 5-hour operation is almost over.
You actually can't imagine what they're doing to him right now, and it's probably as well not to try and imagine it because it's quite horrific, isn't it?
Over the last week or so, I think he's really gone down, and the last 4 days especially. I mean, he's had no sleep. I've had no sleep because he's been mithering me, and so it's been very rapid indeed, especially over the last 4 days, and especially over the last 24, 36 hours.
It's just amazing how quickly these things can happen, isn't it? One minute you've got a bright, lively child, and the next this.
And this one.
Hi, is that Christine? Hi, Christine, it's Paul May. I'm just phoning to say that we've finished Sean's operation. Everything's gone really well. I'm pleased with the way it went. We shouldn't have any major problems. But I'll come and speak to you both in 5 minutes or so. OK, then. OK, bye.
Can you feel anything yet?
All the specimens that we took are infection, not tumour. So we think that it's chronic infection from his nasal sinuses that have infected all around his eye and into his brain and into his temporal fossa. But it's gone really well. We're very pleased. We drained all the pus out. The incision is longer than we anticipated. It comes across from ear to ear, but it's behind the hairline. So we felt that would be better to not give him a scar on the face. We didn't enter the brain cavity. There's no tearing of the covering of the brain. All the pus seems to be out. We've irrigated it out and it's gone very well, so I'm very pleased.
Is there no bad news?
I don't think so. Okay. You'll be able to go and see him in, I should think, 20 minutes or so.
That's excellent. Thank you very much.
Okay.
Thank you.
She never does that to me.
Thanks, Will. Okay. I'll speak later.
Hello, sweetheart. My goodness, you've been through the wars. I bet you don't remember anything, do you?
I remember a dream.
You remember?
A dream.
A dream?
A
Did you dream about? A drink? You want a drink?
Oh, the Jeep. He remembers the Jeep.
Remember the Jeep?
Yeah.
Squeeze your hand if you want us to keep quiet and go to sleep.
Yeah, that
We'll
was a
shut up.
squeeze.
Oh.
A little infection could do all that.
Leon is safely back on the ward after his first night out.
He slept all the way through. It was just me that didn't sleep. Because every noise he made, I was like waking up thinking, oh my God, is he all right? Every little grunt.
So what's it going to be like when you get home?
Horrible. If it's anything like that, I'm not gonna. I'll be like living dead by the end of the 2 weeks or something. Walking about like that, oh, matchsticks in my eyes. You're not bothered though, are you? It'd be hard with her. It's like when she come here for the weekend, she was poking him in the eyes and everything. I was like, oh no, don't do that. Giving you a cuddle and squeezing you to death. Say to her, give him a kiss, give Leon a kiss, and she'd be like that, squashing him.
Angelina will now be able to take Leon home to join his sister. A week later, Sean's bandages are off and only the staples used to bind his scalp together remain.
The histology confirms that it's an inflammatory problem, not a tumour. So that's absolutely clear now from the specimens that we took. The eye swelling's gone down a lot, but he still has this weakness of the nerve that moves the eye on the left side, and that'll get better. And you know, I'm really, really pleased with his progress. I'm sure he'll be fine to go home. See your friends tomorrow.
Sean should now make a full recovery.
We've been told there's an ancient tradition that he's given £1 for every staple. And I said, OK, I thought there were about 35, but you've had half of them taken out. And how many?
36.
36 have been taken out already, and there's another
30 left.
Another 30 left, so Sean reckons it's £66. He's just actually said to me, he said, I'm quite glad I got sick, you know, because I'm going to make £66 out of it. There's an awful lot to go through, Sean, for £66.